Hello friends, welcome to Cortex YouTube channel. In this video, I am going to talk about anti-epileptic drugs. The first drug is phenytoin. Phenytoin is most commonly used, most widely used anti-epileptic agent. So the indication of phenytoin is indication. It is used for control of seizures in GTCS, status epilepticus, and focal epilepsy and trigeminal neuralgia. Okay, so let me talk about some important features of pharmacodynamics and pharmacokinetics. So it acts by zero order kinetics. What I mean by zero order kinetics? Zero order kinetics means fixed fraction of drug is metabolized. Okay, like if you give 100 grams of 100 mg of phenytoin, every time 20 milligrams is metabolized. So in 100 mg, every time 20 mg is metabolized. So this is zero order kinetics, or fixed fraction of drug is metabolized. Now if you take food which is rich in calcium, or there is antacids and ng tube, nasogastric tube, can decrease the phenytoin level in the blood. They decrease the phenytoin, they decrease the absorption of phenytoin, thereby decreasing the phenytoin blood levels. So calcium containing food, rich in food or calcium salts and antacids, presence of antacids and ng2 decreases the phenytoin absorption, thereby decreasing the phenytoin blood level. Pregnancy, old age, and drugs like warfarin, valproate, okay, and diseases like chronic kidney disease, chronic liver disease, all these will increase the free form of phenytoin. Free form means effective or active form. So all these conditions will increase the phenytoin. Calcium antacids ng2 reduces the phenytoin levels. Pregnancy, old age, warfarin and valproate, and conditions like CKD and CLD will increases the phenytoin levels. So what is the dose of this phenytoin? Dose is 300 to 400 mg per day. In adults, you can give 3 to 4 mg per kg per day. It can be given once daily or 3 times daily. In children, this is in adults. In children, 4 to 8 mg per kg per day. Okay, and the T half of this phenytoin is around 24 hours, and the therapeutic levels is 10 to 20 microgram per ml. So this is about pharmacokinetic and pharmacodynamic of this phenytoin. So we talked about indication, we talked about pharmacokinetics. Let's talk about adverse drug reaction or side effects. So side effects of phenytoin are very vast, and they are prominent also. So few of the side effects includes hirsutism, abnormal excessive facial hair growth, and hypertrophy of gums. Hypertrophy of gums, gingival hypertrophy, and osteomalacia, then teratogenic effect, that fetal Hayden-Toyne syndrome. I will talk about this FSH later. And megaloblastic anemia, and ataxia, and lymphadenopathy, and vitamin K deficiency. And arrhythmia. Okay, so this arrhythmia is at acute toxic levels. So these are the few side effects. Let me repeat once again: hirsutism, hypertrophy, gum hypertrophy, osteomalacia, teratogenic effect, that is hydantoin, fetal hydantoin syndrome, megaloblastic anemia, ataxia, lymphadenopathy, vitamin K deficiency, and arrhythmia in toxic levels. So there are some idiosyncratic side effects, like we don't know who will develop this. This is hypersensitivity reactions to these drugs, and in the form of Steven Johnson syndrome. Okay, some rare side effects include rare side effects: purple glow syndrome. Glow syndrome. Okay, next. So few words about fetal hydantoin syndrome. Fetal hydantoin syndrome. So what are the characteristics of fetal hydantoin syndrome? This has the following clinical features, like hypertelorism, hypertelorism, ptosis, and squints. So these are ocular manifestation, like your ptosis means dropping of eyelids, squint, and hypertelorism. Then nasal bridge, depressed nasal bridge, and microcephaly. Next, webbed neck. Comment below where else you see webbed neck. At least I want two syndromes. Okay. Then mental retardation and developmental delay. So decrease in development of distal toe and nails. So these are the characteristic features of fetal hydantoin syndrome. And this is about phenytoin. Hope you find this video informative, and if you like this video, please share and subscribe to channel. Thank you.